During deep sleep, immune function is quite robust, which help fighting inflammation and chronic infections. You look at all the leading causes of mortality, Adil. So
Wow.
directly or indirectly, sleep is impacting all these leading causes of death in the world in today's day. Sleep is the foundation of health. So I hear a lot of people saying that sleep is one of the pillars of health. So from physiological recovery standpoint, deep sleep is absolutely critical because that's the time when the physical body is being restored. Not just that, also human growth hormone, which is responsible for growth and development, is also released during deep sleep. Replays emotional experiences from the day. So it rewinds and it forwards experiences from the daytime for emotional processing and regulation. I tell my patients to imagine sleeping in a cave.
Welcome to Reset by Exactly. This is your host Adil Qayyum. I'm a wellness mentor and I've been coaching people towards experiencing genuine well-being for almost a decade now. And today, once again, we are exploring one of the most underrated pillars of our well-being. I'm thrilled to be joined by Dr. Monica Sharma, who happens to be India's first behavioral sleep specialist and also the founder of Sleep Moksha, the country's first dedicated behavioral sleep medicinal clinic. With over 16 years of experience, she uses her extensive research to help people sleep better. She even shared her expertise at Paris Olympics 2024, making her the first person ever to facilitate sleep medicine in Indian sports on a global stage. As the discussion unfolds, you'll finally begin to decode what your body has been trying to tell you through your sleep. And stay with us till end because we have got some really important gems coming up. Dr. Monica, welcome and thank you for being here.
Thank you for having me, Adam.
It brings me immense joy to even hear about the idea that you have been facilitating sleep for Paris Olympics. Could you please elaborate on that? How was that? What did you exactly do there?
Adil, my experience being a part of Indian contingent, first time ever as a sleep advisor, was incredibly fulfilling.
I can imagine.
But to be honest, it was not that easy. And you can very well understand when you're doing something for the first time,
Yes,
especially in at this elite level in a highly competitive environment, challenges are enormous.
of course.
So, of course, I had my fair share of
Challenges.
challenges, and which was also exciting to navigate. So, the experience was incredible. And as you know, that when you are introducing something for the first time ever in the history, especially at an elite level and in a high performance environment, it is never easy. So, I had my fair share of challenges as well.
So, Dr. Monica, could you please help me understand that while you are working with athletes, and athlete is someone who has already the best facilities, right? And then something simple as sleep. How does sleep play such an important role that it converts a performer into peak performer? Could you please help me understand?
So, as a sleep performance expert, Adil, I one thing I have seen across Olympic and elite athletes worldwide is that sleep is a competitive advantage.
Okay.
See, at this level, at elite level, everybody is training hard.
Yes.
Everybody is pushing
Yes.
harder.
Yes.
So it's not about training more. It is about how well you are recovering. So, one thing I always tell my athletes is that sleep isn't passive. It's that time when your brain is working incredibly hard. It is restoring memories,
Yes.
learning takes
Yes.
place.
Yes.
It is restructuring,
Yes.
reorganizing, it is making you emotionally more stable.
Yes. Yes.
So, in short, sleep is the time your brain prepares you to put your best self forward the next day. I another thing, Adil, that I emphasize to my athletes, which most of them are not aware of, is that sleep is the time, especially if we talk about deep sleep, that's the time when the glymphatic system of our brain, which is the waste clearance network, is robust. It is very
Active.
active.
Yeah.
Yes. So deep sleep particularly is very, very essential because brain is literally doing house cleansing job. It is removing unwanted toxins beta amyloids, the things which are unwanted, and it literally flushes it out of the brain, also taking the emotional clutter away.
That's amazing. Would it be safe to use the analogy that imagine we have a house and every day we have waste that gets accumulated, and if we don't clean our houses, okay, maybe for a few days it may look okay, but after like a week or 10 days, it will look fully messy and then it will not be livable, right? In the same way, if an individual is training a lot and exercising a lot and he's not recovering properly, if the quality of the sleep is not going to be well, it's going to impact his performance. Would that be safe to say?
Again, absolutely, Adil, I agree with you. And how I tell my athletes is that it's like janitors coming every evening and doing the cleaning for you. And when they don't sleep adequately and deeply, then janitors don't show up. So it's a nightly emotional detox that takes place inside of our brain every single night, given we let our brain sleep adequately and deeply.
Amazing. This makes so much sense now because when when the athlete is on the ground, he or she has to make decisions at a very rapid pace, and essentially brain is equal to neurons. How you process neurons at a very rapid space, and if your brain is not functioning optimally, and brain I mean if you're not sleeping properly, your brain would not be functioning optimally, and then that would create a impact on your performance. So hence you once you sleep properly, once you have deep sleep, once you have quality sleep, once you sleep well, your body repairs and then you're able to make smarter decisions. And what I mean by smarter decisions, you're able to make decisions in such a way that you can win matches, right? And also, does this also connect to the idea that endurance have anything to do with sleep?
Absolutely. And not just that, sleep also drives reaction time, precision, decision making. And there are so many studies telling us that even one night of short sleep actually slows reaction time by 20 to 30%. And now that's something an elite athlete can't afford to have, right?
So if this is so much important, why is there lack of awareness about sleep so much? So considering you have been advising Paris Olympics for sleep, and it has had a huge role to play in their overall performance, that itself means that it's a very important subject. Uh, why? And you happen to be the first person. Could you please help me understand why is there lack of awareness on this topic, and what can we do so that the awareness reaches and everyone takes benefit out of it?
So, Adil, sleep medicine in India is a new and emerging field. It is just gaining to it is just sorry so sleep medicine is a new and emerging branch of medicine in India, and it is just beginning to gain recognition. I remember when I was doing my training at the US, sleep medicine at that time was very well established. They had dedicated labs, they had multidisciplinary teams, they had a very structured training program, and most importantly, widespread awareness among physicians as well as public. Sleep as critical component of health. Not just that, we regularly had patients of insomnia, of sleep apnea, restless leg coming for medical care and attention. And sleep interventions were a regular part of the medical system there. When I came back to India, the contrast was stark. Ignorance about sleep is quite profound in our
Of
country.
course.
People presenting with long term sleep problems were actually dismissed by physicians and family members as something stress or maybe a normal part of life. Forget about being diagnosed with a sleep disorder. But things have changed. We have come a long way.
Yes, of course, of
Slowly
course.
and gradually, people are becoming aware, physicians are becoming aware of role of sleep
New products are coming.
in metabolic health, in cardiovascular health. Patients are becoming more aware of how they need to take care of their sleep health. Companies are coming forward and engaging experts like myself, and they are integrating sleep health into their well-being, employee well-being programs. Sleep labs are opening up, at least in major cities. So the shift is taking place, but still, I would say that we have a long
Look.
way to go, especially if I look at teenagers and adolescents, if
Oh
I look
yes.
at working
Yes, yes,
population, which
yes,
are the most sleep deprived.
yes.
So yes, but it is exciting time. At least it's shifting from niche to essential.
For sure. You mentioned about the children and the adolescents. Nowadays, the lifestyle has changed so much, and considering the junk food people eat, and it already disrupts the sleep. Now, nowadays, there's a new problem that has been arising is that the academic excellence of individuals has reduced a lot, and it's also because they sleep late because and they use tech, they use displays, they use their tablets or mobiles right before sleeping, and there are so many other factors which are lifestyle based that interrupt their sleep. Is there any connection between sleep and the academic performance of children?
Absolutely. In fact, my latest work, which I had the honor of presenting at World Sleep Congress,
Okay.
was around this topic.
Oh, that's amazing.
So we looked at the sleep patterns of schoolgoers and also college goers. We looked at their sleep preferences, the total time for which they were sleeping, and insomnia, and how all these factors were impacting their academic performance. And we found out that those students who were sleeping later, who preferred going to bed later, also reported more daytime sleepiness, loss of focus and concentration,
Wow.
resultantly inconsistent academic performance.
Oh, really?
When we compared this group with high achievers, we found
They would sleep
just
on.
the opposite.
Wow.
They were sleeping on time, they were sleeping more than the other group,
That's amazing.
they were reporting less daytime sleepiness, they had better attention and concentration, hence, they were achieving better in academics.
That's so amazing, right? I think this is a message to all the parents that if they want their children to have if they want their children to be academically better, the number one thing they should do is first sleep. It's the most cheapest tool one can utilize to achieve excellence in life. Am I right?
Absolutely. So, when it comes to sleep health, I say that sleep is the foundation of adult health. If that is the case, I say that it is scaffolding for childhood and teenager development
Wow.
because that's the stage of their life when their brain is learning, it is wiring, it is pruning, there is emotional regulation taking place. So, sleep is absolutely critical for this particular age group. Unfortunately, this age group also happens to be the one which is the most sleep
Sleep
deprived.
deprived, 100%.
So we have teenagers and young adults who are sleep deprived, they are overly stimulated, they are emotionally fragile, their memory, their attention is collapsing. That also explains why their mental health is suffering
Oh, wow.
because they have a very basic biological need which is unmet. And most of them, so I've teenagers and young adults are facing a silent epidemic of sleep deprivation. They are in a constant state of partial chronic sleep deprivation of about 1.5 to 3 hours per night.
Wow.
So there's a lot of
That's a
sleep
lot of-
debt that they are carrying around, and unfortunately, weekend is not enough for them to do up the
That
catching
was
up.
going to be my next question. If I we should, adjust that in the weekends, what should one do then? Like, how big of a problem is this? Like, genuinely asking, is it really a big problem or not?
This is as I mentioned that this is a silent epidemic.
It's like-
I have parents bringing their children to my clinic. When I go visit schools, I have educators talking to me, and the complaint is that they are overly dramatic, they are not focusing, they are not concentrating,
Anxious.
they are being rude, they are being arrogant. And the only thing I try to tell educators and parents is that
Fix their sleep.
it is not. So every time I get a chance to speak with parents and educators, when I visit schools for workshops, when I have parents coming in my clinic and talking about sleep problems of the children, they blame it on them. They are rude, they are indisciplined, they are not hardworking, they are lazy, they are overly dramatic, they are emotionally fragile. And the only thing that I try to explain them is that it's not that they are weak, it's not that they are lazy, it's just that their biology and their schedules are in conflict.
Oh.
And once we help them down regulate, once we are able to help them adequate number of hours of sleep that is recommended, we see that a lot of these issues resolve on their own.
Amazing. You mentioned about the biology of the children. That also makes me remember that nowadays nutrition and exercise are two aspects that are also neglected. Kids, especially I mean, below 20 or around 20, they eat a lot of junk food and it's very instinctual eating. There is improper time snacking, late night snacking, binge eating. At the same time, excessive usage of gear, technical gear, be it mobile or be it a game inside home, has also increased, which has led to the decrease of movement. And all of them have directly or indirectly affected the metabolic state of an individual. While improper nutrition and lack of movement affects the body, how does it affect individuals' sleep?
So there's a very close connection between sleep and eating patterns. So hunger regulating hormones, ghrelin and leptin, and also insulin, are directly influenced by sleep.
Yes.
Absolutely. So sleep plays a very critical role when it comes to hormonal health as well. So when sleep is disturbed or poor sleep, and especially we see that in a lot of insomnia patients as well, they have a tendency to go in for foods which are high in calories.
Yes.
They have cravings, they have binge eating, especially because they are sleeping very late because of insomnia. They prefer watching something on television, or they're glued to their screen. They are either gaming or they are watching Netflix. So that becomes a vicious cycle. Delayed sleep timings, tech, screen exposure, and binge eating. So that is a dangerous combination, which is leading to obesity, especially in children.
And kids do not happen to get out of it very easily, right? It's very difficult also, right? So imagine me as someone who is sleep deprived, or one of my kids is sleep deprived. What should be my next step? Should I go for a traditional way approach to fix it, or should I go for a modern approach, have some medicine, and solve my sleep problem? What is the most effective way for me to do it?
So, as a sleep expert, I always say that how you approach sleep matters just as much what you treat. So,
Okay.
if we talk about traditional sleep medicine, it mainly focuses on medication and diagnostic tools, especially those disorders with a biological basis. Medication is absolutely necessary.
Okay.
So, there is a valid, respectful, and a defined space of medication in sleep medicine.
Okay.
Yes. When we talk about behavioral sleep medicine, so I'll break it down for you. So, in traditional sleep medicine, the question would be, how do I fix the sleep problem?
Yes.
Whereas in behavioral sleep medicine, the approach would be, what are the factors that are contributing or maintaining this sleep problem,
Two different
and
things.
how do we navigate it?
Okay.
So in BSM, the focus is looking at the root cause of the problem and intervening it. Whereas in traditional sleep medicine, the focus is primarily on medication and fixing the symptoms rather than solving the problem at the root cause.
Okay. So generally, you wouldn't recommend someone to directly go for medicine. First of all, fix the behavioral, and then if in case the behavior is not changing the sleep, only then we can go for the medicine.
So there are about 80 different sleep disorders. As I
80.
mentioned, yes, there are 80 different sleep disorders. So a sleep disorder with a biological basis, medicine is prescribed and it is essential. Whereas if I talk about, say, chronic insomnia, so according to American Academy of Sleep Medicine, the gold standard or the first line of treatment is not medication, but non
Behavioral change.
pharmacological treatment or cognitive behavioral therapy. Again, because the idea is that we get to the root cause of the problem, we understand the why and the hows and the contributing factors, and the BSM focuses on training the brain to sleep again.
It's like a proper therapy that one has to do, right?
Yes.
So you mentioned there are 80 kind types of behavioral sleep problems we have. Is there any test one should do, or would you recommend it for common people to do it, or is it only for athletes? to determine what sleep problems you have?
Yeah. So for the diagnosis
For the
of
diagnosis.
sleep problem, see, the science of sleep remains the same, whether
Yes,
they're
yes.
athletes or they're
Just to determine
non-athletes.
what I mean, out of 80, which
Yes.
one I have.
So typically, a sleep expert would do a workup with the patient, and it's
Okay,
quite a comprehensive workup. I
okay,
spend around 45 minutes with my patients to do
okay,
the workup because I
okay,
want to understand the whys and the hows of their sleep problems.
okay.
Yes, if there is an indication, we do subject our patients to medical diagnostic tests as well. For example, if I am suspecting sleep apnea, then there's a gold standard test that we do for them where and we have the patient come in, we hook them to various,
That's amazing.
yes, electroencephalogram. So we directly look at their brain waves, we look at their respiratory system, we look at their heart functioning. So it's quite elaborate. So there are different diagnostic tests for different sleep condition that a sleep doctor is evaluating.
Amazing. On a different tangent, does sleep have to do anything with immunity? Because a lot of people are falling sick quite often nowadays, and they're also not sleeping. I wonder if there's any connection between immunity and sleep.
Yes, there is a connection. Sleep is the time, especially during deep sleep. During deep sleep, immune function is quite robust. It releases cytokines and other immune cells which help fighting inflammation and chronic infections. And when someone is sleeping inadequately and poorly and not meeting the daily dose of sleep, then this natural protection, the mechanism, comes down and makes a person more vulnerable to catching inflammation and infections, especially common cold.
While I'm on this tangent of asking you questions related to sleep, again, one more thing came to my mind is the idea of metabolism. A lot of people say that, hey, my metabolism is high, my metabolism is low, I can't do anything on it. Does metabolism happen to do anything with sleep?
Yes, it does.
Interesting. Please help me understand because it looks like
Because
everything is connected to sleep.
yes, absolutely, it is directly or indirectly. If you look at all the leading causes of mortality, Adil, directly or indirectly, they are all influenced by sleep, good or bad. So you talk about psychiatric disorders, you talk about cardiovascular disease, talk about metabolic disease, you talk about neurodegenerative disease, you talk about suicide. So
Wow.
directly or indirectly, sleep is impacting all these leading causes of death in the world in today's day.
Wow. I was going to ask you about cognition and so many other things, but I want to ask you something very simple. Why? What's actually happening? Like, I understand sleep is, if we don't do this, sleep will impact, or if we don't sleep properly, this will happen. But what exactly is happening? And what do you mean by sleep? I understand sleeping, closing eyes, but what is sleep and what exactly is happening behind the scenes that and common individual is not able to understand? Yes, we have seen podcasts. Yes, we know that sleep is important, etc. But could you break this down to me as if I'm a 5 year old and actually help me understand what's happening and why is it actually important? While I understand that you actually spoke a lot about it, but make it very simple for me so that everyone understands, because based on your interaction and top points you mentioned so far, I can for sure and guaranteed say that, be it for anyone to experience genuine well-being or health or just be fit, fitness, diet, meditation, awareness, everything is secondary. The first has to be sleep.
Absolutely.
Please.
So that is the reason why I say that sleep is the foundation of adult health. So I hear a lot of people saying that sleep is one of the pillars of health,
Yes.
and I respectfully
This is a
disagree.
foundational pillar, I would say.
I respectfully disagree because after air and water, the next most essential need for human survival is sleep.
After air and water? Wow. That
It
gives
is
it like a.
not nutrition, it is not movement, right? When a person is chronically sleep deprived, the brain and body, it starts breaking up shockingly fast.
Wow. Thank you. I have one more question. That while understanding sleep, there is this fancy words used as REM sleep, deep sleep, and stages of sleep. Could you please break down that for me?
Sure, absolutely. So when we study sleep, we call it sleep architecture. There are various stages of sleep that brain goes through.
Yes.
Stage 1, stage 2, 3, REM sleep. So, stage one and stage two, these are the lighter stages of sleep. When we say deep sleep, we are referring to deeper stages of sleep, that is stage three. And whereas REM sleep is rapid eye movement sleep, right? That is where all the vivid dreaming takes place. So, from physiological recovery standpoint, deep sleep is absolutely critical because that's the time when the physical body is being restored in terms of muscles, in terms of ligaments, in terms of inflammation, soreness. After a brutal workout, there is stiffness, there is soreness that these athletes and even non-athletes experience. So, physical restoration takes place during deep sleep. Whereas if we look at REM sleep, it is absolutely critical. Not just that, also human growth hormone, which is responsible for growth and development, is also released during deep sleep. So this is absolutely critical from physical restoration standpoint. If I talk about sleep if I talk about recovery in sleep from cognitive standpoint, REM sleep is absolutely critical because that's the time when brain actually regulates emotions. And many interesting things take place in REM sleep. It literally replays emotional experiences from the day. So it rewinds and it forwards experiences from the daytime for emotional processing and regulation. Unpleasant experiences, threatful experiences are literally deleted, less intensified and deleted by the brain and just erased from the memory. So there is learning, there is memory consolidation, there is emotional regulation. Many magical things happen
While I sleep.
while we are sleeping. From the outside it may appear that it is simple rest, somebody's going and just you're lying there unconscious, but as I mentioned, that sleep is brain's activity where it is doing incredibly hard work. It is reorganizing, it is restructuring, it is rejuvenating, it is recovering body and mind from the wear and tear that we subject it to during wakeful hours. So, REM sleep, rapid eye movement sleep, is when the vivid dreaming takes place. And this is absolutely critical for emotional regulation.
Okay.
And this is the time where brain literally replays emotional experiences from the day. It processes it restores it decides what to keep and what to discard. Emotional, unpleasant, threatful experiences are de-intensified and literally deleted, erased from our memory. Dream plays a very significant role in the sense that it helps in processing the emotional clutter. So REM sleep, we can say, is like emotional reboot that takes place during the nighttime.
Thank you so much for the wonderful explanation on what REM sleep is, deep sleep is. Thank you so much for helping me understand what deep sleep is, how REM sleep is, how emotional stability, and dreams, etc., play a role in our life. Could you, now that we have established that sleep is, I would say, the most important aspect of our well-being, could you please give me 2 to 3 actions that I can take so that I can achieve a better sleep? But I shouldn't have to take so much effort. Also, should make it easy for me. Okay.
So, some of the very easy ways to improve your sleep health, I would say, is to first thing first, take care of the environment that you are sleeping in. So, when we talk about sleep, I tell my patients to imagine sleeping in a cave.
Okay.
So, when you enter cave,
It's full dark,
it is full dark and
cold,
it is cold and
silence.
it is silent.
Nice.
So, a cave like environment, if we can create in our bedrooms or our sleeping environment. Now, the reason why we tell our patients to do that, there's a whole science behind it is because for brain to initiate the process of sleep, it needs to bring its core body temperature down.